Prior to performing the thyroid examination, the patient's history must be taken. We have removed the portion for the convenience of the video. However, it is important to note the key hyperthyroid and hypothyroid features to keep in mind when taking history.
Good morning. I am a third year medical student. Today I am going to do a thyroid examination on you. Is that okay?
Yes, that's okay.
During this examination, I will closely inspect and lightly palpate your thyroid. If you feel any sort of discomfort, let me know. I will stop the examination. Would you like to carry on the procedure?
Okay.
The examiner washes his hands and put on gloves prior to the examination. General inspection must be performed prior to the thyroid examination. These are the signs to look for: facial appearance, signs of dry and coarse hair, periorbital puffiness, exophthalmos, ophthalmoplegia, lid lag, upper limb, sweaty palms, tremors, lower limb, pretibial myxedema, ankle swelling.
The doctor inspects the neck and thyroid closely for neck swelling, neck asymmetry, coitus or lump, not diagnostic because the patient can be euthyroid. Redness can be indicate a thyroid abscess, dilated blood vessels to exclude retroesternal extension, swallowing test. Ask the patient to drink a glass of water and test if lump moves while swallowing. The doctor moves to stand behind the patient to palpate the neck. Important note when palpating thyroid. One hand should stabilize neck while other hand palpates. Make sure to note the size, shape, consistency, number of nodules palpable, and tenderness. When assessing tenderness, make sure to look at the patient's face for signs of pain. Diffuse tenderness typical of viral thyroiditis. Localized tenderness could indicate bleeding into thyroid cyst. The swallowing test will be performed again, ideally with a glass of water. This time, try to feel if you can get below the lump. This excludes retroesternal extension. Palpate the lump for a thrill. Check for tracheal deviation. Palpate the cervical and supraclavicular lymph nodes for any evidence of any swollen or enlarged lymph nodes.
The doctor percusses the mandible area and the upper intercostal spaces to access for the dullness. This is to exclude retrosternal extension. If the doctor feels a lump, they should use their stethoscope to auscultate. This is to hear any thyroid brood, which indicates a very high blood flow, most commonly associated with Graves' disease.
Now the examination is over. Thank you for your cooperation.
Thank you.